Okay, so good day everyone. Today we'll be talking about your chapter 9, your special populations. Okay, so let's talk about first the definition of terms. So number one, you have your habilitation, or habilitation includes all activities, interactions that enable an individual with a disability to develop new abilities to achieve his or her maximum potential. Rehabilitation, the relearning of previous skills, which often requires an adjustment or to alter the functional abilities and altered lifestyle. So ano nga ba ibig sabihin ng habilitation? No? Sabi dito lahat ng mga activities or the way that a person would interact the to other people and to also this applies to those people with physical disabilities like being deaf or blind or could be a person who has difficulty in walking or um, there's a missing part or a limb in their physical appearance, like their hands or missing hands or missing arms and legs, and some people might have mental disability or they have a difficulty in learning. So a part of this, these people would have to learn how to adapt to their physical appearance or to their physical capacity. And for them to be able to achieve their maximum potential, they have to learn and to go to a certain school which trains an individual with certain disability or yeah, a certain disability or probably a person with physical deformities. Also, rehabilitation, the relearning of previous skills, which often requires an adjustment to altered functional abilities and altered lifestyle. So kadalasan, yung rehabilitation, this would involve people who got into an accident where they are living their lives in a normal way. What I mean by that, those people who are got involved into an to a vehicle accident or vehicular accident, and people who might have suffered from a particular disease that might have altered their functional or might have impeded or hindered them to do their physical activities on a day or their activities in daily living. Okay, like uh, these people might have also something to do with their disease. So kaya nasasabi dito na kaya kasama dito yung lifestyle nila. So rehabilitation, of course, this will involve occupational therapist, speech therapist, and physical therapist that will help them to move and speak and probably also to eat food on that will help them to go back to their previous function. Okay. So Americans with Disabilities Act enacted in 1990. This legislation has extended civil rights protection to millions of Americans who are disabled. The ADA defines a disability as a physical or mental impairment that substantially limits one or more of the major life activities of the individual. So dito din sa atin, meron din tayong batas in regards with people with disabilities. No, kaya nga mapapansin nga ninyo, we have this cards well, for persons with disabilities. No? Hindi lang tayo tumingin kasi doon sa mga tao na may physical disability like yung mga pilay, bulag, o pipe, or bingit. So also, might be yung mga kasama din dito of course yung mga tao na merong problema sa paningin, no? Ay hindi lang paningin pala. Or maaaring hindi sila bulag totally, but they have difficulty in seeing. No? They might be have been suffering from particular disease for the eye, nahihirapan silang tumingin or nahihirapan silang makita yung mga bagay-bagay. No? Um, mukha silang normal sa una kung titingnan ninyo, but those people already have physical ability which hinders or limits their vision. Yan. So, nahihirapan sila mag-drive or people with color blindness. So, akala natin normal yung sa ibang tao, no? And some people would mock them or make fun of them. Yan. So, that particular law, uh, wait, that particular law for the PWDs or the persons with disabilities here in the Philippines. So, the Republic Act here in the Philippines is your RA or Republic Act 7277. This is an act providing for the rehabilitation, self-development, and self-reliance of disabled person and their integration into the mainstream of society and for other purposes. Para hindi sila maitsapuera, they can still work as a person, as a whole, even if they have this difficulty in moving around, but they have to be trained para magkaroon sila ng kabuhayan or makapaghanap buhay din sila para sa pamilya nila. Okay, so continuing, we have the educator's role in assessment of client. So, educator's role in assessment of client needs, one, of course, the nature of the problem. Ano nga pinagmulan ng problema, no? And ano ba yung mga kailangan i-address para maayos yung problem na yun. Short and long-term consequences of disability. No? Titingnan natin kung ano yung mga panandalian lang or pangmatagalan. And of course, this has to it would depend on the severity of the disease or the disorder or the disability that the person has. So meron tayong short and long term, no? It could last for days, weeks, or months for the short term. Um, but on the long term or on the long run, it could last 6 months or more. No? With in terms of the disability of the person. If it's a vehicular accident, if it's not severe and di naman na-damage yung spinal ng pasyente or yung brain ng pasyente, walang masyado naging damage, weeks or months should be enough for the patient to recover. But for the lifetime, if there's a severity in the physical appearance or the physical aspect of the patient, and lalo na kung inborn yan, then of course it would last a lifetime and further assistance and further education with how the person would survive or learn, rather, part of the learning process, no, ng isang tao. How are they going to take care of the person or how the person will learn? How are they going to assist the person with the learning aspect? Okay. So coping mechanisms, we have lots of coping mechanisms, no? And how are we going to help a person to cope up with their physical disability? So of course, pagka sinabi natin coping mechanism, this has something to do with the conscious or non-conscious adjustment or adaptation that decreases tension and anxiety in the stressful experience of or a situation. How are we going to modify those maladaptive coping mechanisms in which the focus of psychological intervention. So ano nga ba isang importance ito? So this process is also called the coping. So according to Lazarus, defines coping as an individual's efforts to manage the psychological stress associated with his or her situation. So according to some research or study uh, um, in Biomed Central, so there are three major coping strategies emerge. These are the problem-focused, emotion-focused, and spiritual or religious-focused coping strategies. Okay? And also, there are other types of coping mechanism. Meron pa tayong apat pa na types. So, meron pa tayong tinatawag na appraisal focus or adaptive cognitive, then problem focus. So, yun, pala yung wala kanina. Appraisal focus, adaptive cognitive, and of course your occupation focused coping. And you have your behavioral, your problem focus pa rin siya in terms of behavioral. How the person would adapt from his or present problem. And of course, hindi natin po disregard yung emotional status ng pasyente, lalo na kung nakakaramdam na sila ng anxiety or they are becoming depressed. So it has to be also addressed no, or especially the sadness that they are feeling, especially if the person is not used to being or having that kind of disability and type of extent of deficits. Meron tayong tinatawag na so of course pagka sinabi natin extent, no, this has something to do with the vision impairments, hearing impairments, and types, and mobility impairments, and meron pa tayong cognitive and speech impairment na tinatawag. So, of course, pagka sinabi natin vision, a person who is blind has impairment with vision, a person with an eye injury has a temporary vision impairment, a person in a bright environment has a situational vision impairment. Hearing impairment natin, a person who is deaf has a permanent hearing impairment. A person with an ear infection has a temporary impairment. A person in a noisy room has a situational hearing impairment. And of course, you have your mobility impairments. A person who is paralyzed has a permanent mobility impairment, and a person with a broken arm has a temporary mobility impairment. Um, Also, a person carrying a large box has a situational mobility impairment. Cognitive impairments, a person diagnosed as having dyslexia as a permanent cognitive impairment. A person with a concussion has a temporary impairment. A distracted driver has a situational cognitive impairment. Then speech impairments, a person with apraxia of speech has a permanent speech impairment. A person with laryngitis has a temporary speech impairment. A person with a heavy accent has a situational speech impairment. So, yun yung mga types and extent, no? May permanent, may temporary, and merong sa situation. So, depending dun sa tao and how are they going to cope up with their situation will be up to the educator also. So, part ng pagiging educator of course is we have to make sure that the person will understand and will learn how they can cope up with their situation. And extent of client's knowledge deficits, no? Pagka sa of course, pagka sa mentality or sa something to do with the um, with the cognitive aspect. So, iba kasi merong limited or they have um, learning difficulties. No? And hindi naman natin masisisi din sila kasi meron iba talagang mga pinanganak na delayed learning and meron pinanganak na tinatawag natin na merong mental retardation. Okay? So, may mga types din yan na nahihirapan sila na intindihin or matutunan yung mga bagay-bagay. No? Masyadong mabagal yung thought process or masyadong mabagal yung learning process or learning capacity na meron sila. Okay, and of course, clients' readiness to learn. Once they are showing signs of readiness to learn, they're showing interest and eagerness, then that's the time that you should teach the client. And of course, the client support system, family and friends, of course. Yeah. And those person who are willing to assist them and take care of them and look after them while they are trying to learn or they are trying to recover from what happened to them. Okay. Okay, so types of disabilities, you have your sensory deficits, learning disabilities, developmental disabilities, mental illness, physical disabilities, communication disorders, and chronic illness. As some of this I have mentioned earlier. No? And so mga learning disabilities, developmental abilities, this has something to do with the brain of the person. Okay? Pagka physical disabilities, it could be inborn or it could be a result of an accident. And so communication disorders might also be resulted from an accident or it could also be an inborn. And of course, pagka chronic illness, something to do with the bacteria and viruses that might have infected the person. No, may mga sakit kasi na pagka naapektuhan ng brain ng pasyente, maaaring hindi na sila makabalik dun sa normal functioning nila or dun sa dati nilang mga kakayahan. So sensory deficits, hearing impairments, this refers to type of hearing loss, complete loss, or reduction in sensitivity to sounds, the etiology of which may be related to either a conduction or sensory neural problem, and 1.8 million Americans are deaf and an additional 10% of people have some degree of hearing loss. Okay, so dito sa atin din marami, I don't know how many, but I'll try to look into it then while I'm discussing this. And also, um, ano ba? Be careful also with taking the medicines. So some medicines, like for example, the antibiotic, with a high dose that could result to partial hearing loss. Okay. So in the Philippines, it is estimated 121,000 deaf Filipinos according to the 2000 Philippine census. Okay, often the hearing might not be conscious of them or their experiences, but it doesn't mean that they don't exist. So this study is around 2018. Okay, and according to an article in NIDCD, NIH.gov, one in eight Filipino in the United, 1 in 8 people in the United States, 13% of 30 million, aged 12 years or older, has hearing loss in both ears based on the standard hearing examinations. And while some adults aged 45 to 54 have disabling hearing loss, the rate increases to 8.5% for adults aged 55 to 64. So this might be the same or might be near dun sa population na meron tayo. So, according to some study, approximately 150 Filipinos are born daily with hearing loss and a staggering 27,000 profoundly and bilaterally deaf each year. So, yun siya. Right? And, sorry. So, hearing impairments, etiology nga, it could be congenital, trauma, or a disease. Or sometimes it could have something to do with the medicine that we are taking. Lalo na kung masyadong malakas yung dose, especially the antibiotics. Factors affecting communication, degree of hearing loss, and of course, the length of impairment. So hearing impairments, modes of communication to facilitate teaching learning, American Sign Language ASL. So we also have here in the Philippines that we have Philippine Sign Language then. No? Um, in a school where I am working also right now, we have a special education for people with hearing disabilities. And also part of the learning for them to communicate with you is that they will try to learn lip reading or they will try to interpret or understand your words by reading your lips. Of course, you also have the written materials, verbalization by client, sound augmentation, and telecommunication devices for the deaf or what you call your hearing aids. Okay. So, general guidance for teaching: use natural speech patterns, do not over articulate, use simple sentences, get attention of the client by a light touch on arm, face the client standing no more than 6 feet away, avoid standing in front of bright light which obscures your face, minimize motions of your head while speaking, refrain from placing uh, IV in hand that the client needs for sign language. So kung ano yung dominant hand nila, no, dun sa mga pasyente natin na merong or PIPE, no? Kung ano yung dominant hand nila that they are using to communicate, you're using sign language. Of course, we do not place an IV or IV line there. And these guidelines that is being shown to you or being explained to you right now these are the things that you should remember when communicating to clients with uh, hearing disabilities and they are also unable to speak. So, sensory deficits, visual impairments, illegal blindness defined as a vision of 220 over 200 or less in the better eye with correction of or if visual field limits in both eyes are within 20 degrees diameter. More than 2.5 million Americans over age 65 are severely impaired. Etiology: infection, trauma, poisoning, congenital, and degeneration. So, kung sa Amerika ganyan kalaki, so sa atin ngayon 2018, way back 2018, population with vision impairment or blind are approximately 500,000, and majority of them are poor and uneducated. So meron tayong ginagamit na instrument for the blind people for them to be able to read and learn. You have your braille, no? Yung tinatawag natin na braille. So yun yung may mga naka-emboss or may nakaalsa or nakaumbok na mga circles uh, that serves as an alphabet for them to be able to read. So kung mapapansin din ninyo sa elevators, meron dun mga naka-emboss dun na mga metal, na yung mga nakabukol. That's the use of those metal for the people to be able to read or to know where they are. Okay. So, factors influencing functionality. Again, we had the degree of impairment, length of impairment, and common eye diseases of aging, macular degeneration, particularly for those patients who has um, diabetes. So, andyan din yung cataract, glaucoma, and yung diabetic nephropathy. Macular degeneration can also be associated with diabetic retinopathy. So, balikan ko lang po. So, yung glaucoma, kadalasan nawawala sa kanilang una is if I'm not mistaken, their peripheral vision. Until such age or time na totally blind na sila, wala na makita. While your cataract is the accumulation of white or yung mga white materials or components or tissues na nag-accumulate or nagbi-build up sa mata ng isang tao kaya sila nabubulag. Okay, so general guidelines for teaching secure services. Secure services of a low vision specialist to obtain adaptive optical devices. Avoid the tendency to shout and use nonverbal cues. You know, always announce your presence and identify yourself. Allow the client to touch, handle, and manipulate equipment. So, ito, isa pa dito yung gamit ng mga service dogs for the blind. And of course, they have the cane. If you allow them to touch your face, somehow they will be able to recognize you. And of course, the tone of your voice. That is why you have to let them know or introduce yourself if, once you are in the room or when you are entering the room. Okay. So why do we allow the client to touch the handle and manipulate the equipment so that they can familiarize themselves or with the equipment that they have for the first time doon first time gagamitin yan, and of course they would recognize it sa mga handle kung ano-ano mga equipment yung meron dun sa paligid nila. Yan. Being descriptive in explaining procedures, use large font size or printed or handwritten materials. This is only applicable for those patients who are partially blind. But for the descriptive and explaining the procedures, you have to be very specific. And you have to have a patience lalo na sa mga totally blind na mga tao when you are explaining something to them. Avoid color. Rely on black and white or printed materials, especially for those patient or people who has color blindness. Use alternative instructional tools that stimulate auditory and tactile senses so that they will be able to learn. So learning disabilities, you have your heterogeneous group of disorders of listening, speaking, reading, writing, reasoning, or mathematical abilities. Other terms for learning disability, you have your minimal brain dysfunction, attention deficit disorder, ADD. Then you have your dyslexia and hyperactivity. So what is minimal brain dysfunction? So minimal brain dysfunction, your MBD or ADHD, refers to an impairment of brain functions that affects the brain area or the area of the brain associated with perception, behavior, and academic ability. So yun yung mga affected parts ng brain natin. And when it comes to minimal brain dysfunction, or you have your ADHD or attention deficit hyperactivity disorder. Okay. So minimal brain dysfunction is also associated, or attention deficit disorder is also associated with minimal brain dysfunction. It is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, and they may act without thinking about what the result will be, or be overly active. So, paano nga ba malalaman kung may ADHD yung isang bata? So, number one, hyperactivity and impulsiveness. Being unable to sit still, especially in calm or quiet surroundings, constantly fidgeting, being unable to concentrate on tasks, excessive physical movement. So, yung kadalasan na makikita niyo mga kadagahan, flopping, or parang yung ginagawa nila parang lumilipad sila yung mga kamay nila. Yung masyado malikot. Yan. Excessive physical movement. They cannot sit still for at least 5 minutes, and they have excessive talking, being unable to wait their turn, acting without thinking, and interrupting conversations. Little or no sense of danger. So, basta gagawin lang nila yung mga gusto nilang gawin. So, inattentiveness, no? Inattentiveness, difficulty concentrating and focusing. So, the main signs of inattentiveness are the following: having a short attention span and being easily distracted, making careless mistakes, for example, in schoolwork, appearing forgetful or losing things, being unable to stick to tasks that are tedious or time consuming, appearing to be unable to listen or to carry out instructions, constantly changing activity or task, having difficulty organizing tasks. And there are also related conditions in children and teenagers with ADHD. They may have anxiety disorder, which causes the child to worry and be nervous much of the time, and it may be also cause physical symptoms such as rapid heartbeat, sweating, and dizziness. Oppositional defiant disorder. This is defined by negative and disruptive behavior, particularly towards authority figures such as parents and teachers, and Conduct disorder. This often involves a tendency towards highly antisocial behavior such as stealing, fighting, vandalism, and harming people or animals. Then it also may lead to depression. Then followed by your sleep disorders, finding it difficult to get to sleep at night, and having irregular sleeping patterns. And autistic spectrum disorder (ASD), this affects social interaction, communication, interests, and behavior. Dyspraxia, a condition that affects physical coordination. Epilepsy, a condition that affects the brain and causes repeated fits or seizures. Tourette syndrome, a condition of the nervous system characterized by a combination of involuntary noises and movements, or what you call your tics. So ito yung sa mga maririnig pa ninyo na nagmumura. And also learning difficulties such as dyslexia. So ano ba yung dyslexia? Kanina pa natin sinasabi dyslexia na yan. Okay? So dyslexia is a common learning difficulty that mainly causes problems with reading, writing, and spelling. It is a specific learning difficulty, which means it causes problems with certain abilities used for learning, such as reading and writing. Okay, unlike a learning disability, intelligence isn't affected. It is estimated up to 1 or every 10 people, no? And has some degree of dyslexia. So maraming pwedeng magkaganon. Pero kadalasan ang dyslexia is common among Caucasian people. Hindi siya ganun ka-common sa mga Asians. Okay. So dyslexia can be lifelong, or it is a lifelong problem that can present challenges on a daily basis, but support is able to improve reading and writing skills and help those with the problem be successful at school and work. So, what are the signs of dyslexia? A person with dyslexia may read and write very slowly, confuse the order of letters in words, confused by letters that sound similar, write letters the wrong way around, such as B and D, and have a poor, consistent spelling, understand information when told verbally but have difficulty with information that's written down. Okay, find it hard to carry out a sequence of directions and struggle with planning and organization. There are also people or organizations that also help people with learning disabilities. So approximately 10 to 15% of the American population is affected. The majority have language integrity processing or memory deficits. Most have normal or superior intelligence. So in the Philippines, if the data of the Department of Education showed that out of the estimated 444,294 children with disabilities or CWDs, only 112,810 are enrolled in 2021. So, ang laki ng population na hindi naka-enroll. So, kasi dito sa atin sa Pilipinas, masyadong mahal magpaaral ng mga tao or patient na merong tawag dito, learning disability. Masyado rin konti din yung nagtuturo. So, karaniwan, mga private institutions. Okay. So, input disabilities, difficulty receiving and recording information in brain, types of, okay, so categories tayo. So types of input disabilities, you have your visual perceptual disorders, auditory perceptual disorders, integrative processing disorders, short-term or long-term memory disorder. Output disabilities, difficulty responding orally and or performing physical tasks. Types of output disabilities, language disorders, and motor disorders. Then followed by your attention deficit disorders. So general teaching strategies for clients with learning disabilities: eliminate distractions, provide a quiet environment, conduct an individualized assessment to determine how client learns best, adapt teaching methods and tools to clients' preferred learning style, ask questions of parents about accommodations needed in client if client is a child. So also, use for repetition to reinforce messages, ask client to repeat or demonstrate what was learned to clear up any possible misconceptions, use brief but frequent teaching sessions to increase retention and recall of information, encourage clients' active participation. Okay. So those are the strategies that will help an educator uh, to teach a client with learning disabilities. Right? They may have difficulty in learning, but you have to have a very long patience to teach them the necessary things that they have to learn. Okay? So, papansin ninyo dun sa mga ibang bansa, lalo na sa Western countries, no, they are able to teach those with autism. And some of those people with autism are already working or they are able to work in offices and even in the fast food chains. So they are very highly functional. Okay. So developmental disability is a chronic state that is present before 22 years of age, is caused by mental and or physical impairment, and is likely to continue indefinitely. So public laws providing for special education means Education of All Handicapped Children Act of 1975 and Developmental Disabilities Act of 1978. That's in the America. So like what I have said earlier, we have your Republic Act 7277, no? An act providing for the rehabilitation, self-development, and self-reliance of disabled person and their integration into the mainstream of society and for other purposes. And you also have your RA or Republic Act 9442, all about. This is an act providing for the rehabilitation and self-reliance of disabled persons and their integration in mainstream society, other purposes. And so, kasama doon sa 9442, it is similar with your 7277, but this is the revised one. No? Um, let's call this mainstream society, and now other incentives and prohibitions on verbal, non-verbal, ridicule, and vilification against persons with disability. So yun yung in-improve pa nila para maprotektahan yung mga tao na may disability. No? So your Republic 777 began in July of 1999. Sorry, that's 1991 or 1991. And it was amended and revised as your RA 9442. So RA 9442 was or has became a law in March of 2018. So also Individuals with Disabilities Education Act of 1990 or IDEA that's in the US. So this is still under with your 9442. Okay. So, general teaching strategies keep in mind developmental stage, not chronological age. Provide concrete examples and explanation and simplify task. So, kaya kasi sabi natin dito, hindi importante ang physical appearance or age or the age of the person. Kasi pagka mayroon learning or developmental disability ang tao, you have to consider the developmental stage of a person. Not the physical appearance, not the age, but the physical or the functioning of the brain of the person. Maaaring yung utak ng tao na mayroong developmental disability somewhere around 5 years old or 6 years old if his or her age is around 17 or 18 or 19 or 20 or older. So also use verbal and nonverbal cues, be consistent, use repetition, encourage active participation, and praise positive behaviors and accomplishments. Okay? In that way, this person will, with developmental disability will still be